25-year-old young man, presents with severe pain in the left femur. The pain is relieved by aspirin. Well, the moment they talk about aspirin, you start thinking about salicylate, non-steroidal anti-inflammatory drug. Mechanism of action is inhibition of prostaglandins, night pain, relief. So something like osteoid osteoma. Anyhow, let's read further. On a plain X-ray film, there is a 0.5 centimeter lucent lesion which is surrounded by marked reactive sclerosis. So diagnosis is, I hope I have already given you a hint. Like if they would have been talking about osteosarcoma, the option D, they would have mentioned sun reappearance and Codman's triangle and malignancy and distal femur and metaphysis. If they would have mentioned osteoma, option A, they would have mentioned skull and frontal bone, all that thing. Now B and C, of course, both can have pain, both can have relief by aspirin, but it is more classical of osteoid osteoma. Plus, this 0.5 centimeter lucency is very classical of osteoid osteoma surrounded by sclerosis. Because in osteoid osteoma, you see less than 2 centimeter radiolucent lesion, which is surrounded in periphery by, sclerosis. So in osteoid osteoma, I'm sure this red arrow can show you the classical location of osteoid osteoma, which I'm able to show you right now. So this is the classical location. It is the proximal femur just below the neck, inner margin, diaphysis. And this is what you're looking at right now is a 0.5. I mean, it's usually less than 2 centimeter radiolucent lesion, which is surrounded by peripheral reactive sclerosis. And why night pain is important? Because this central radiolucent lesion is a very chief nidus for accumulation of exuberant amount of prostaglandins. So therefore, aspirin relief in the night pain is classical. So in this question, the answer will be B, osteoid osteoma.